Hi everyone, welcome to my channel dedicated to helping people feel whole again. My name is Dr. Andrea Poi. I'm a licensed naturopathic doctor. I graduated from Bastyr University of San Diego. I currently work with clients one-on-one through my own telehealth practice called Whole Health Naturopathic Wellness Center, where my main focus is women's health and integrative cancer care. I do, however, also see digestive issues, metabolic conditions, and other immune-related disorders. So now that you know a little bit about me, let's take a step into today. Let's just jump right into the discussion on what naturopathic medicine is. So let me just pull up my screen to share. So I have a little PowerPoint for everyone to just follow along, just so they don't have to, they have something to look at while I'm talking. Let's see here. So before we begin, I did just want to bring up this disclaimer that nothing said during this video should be interpreted as medical advice. It's only for educational purposes. I won't really be talking about anything medical related other than what naturopathic medicine is, but just in general, I just wanted to put this out there anyway, and just make sure to consult your doctor if you're debating on making any changes or switching to natural therapies, anything like that. So let me jump over to the next topic, which is what naturopathic medicine is. So enlarge my screen here so you can see me. So naturopathic medicine is amazing. So it is very unique. And I put a bunch of words here to help explain kind of in just a few different words on how naturopathic medicine works, what it is, and the best ways to describe it. So as you can see, naturopathic medicine is very unique because it incorporates both the conventional side of things and the holistic side of things. So we kind of are the bridge between your regular doctor and more holistic ways of treating. So we use natural therapies and conventional therapies. So that is one thing that really sets us apart because you get the best of both worlds. We're trained in both. And we're able to see an individual in front of us and determine what fits them the best. So we use a evidence-based decision. We look at the research. We make sure that we know, if this medicine would be most beneficial to this person, or if we see, okay, well, we have research showing that this natural therapy is just as effective or almost equally effective, but with less side effects. So we're going to prescribe this instead. So that's just one example of how we go about treating an individual. We see them as an individual. We realize that everyone has different pathologies, physiologies, and different environmental factors playing into their conditions, and just really want to emphasize individualized care because not everyone should receive the same treatment, even though they have the same condition. Because there's so many factors that go into why that person got disease in the first place. So that's another thing we look into, root causes. So we're always investigating why someone has disease, why they got sick in the first place, why their body is responding in the way it is, and trying to address that root cause so eventually they can heal instead of just suppressing symptoms, because that's not going to play out well in the end because the root cause is still there, still causing disease. And while you're suppressing one pathway, you're going to have that root cause become entwined with the rest of the body because it's a whole, and it's going to cause disease elsewhere in the body. So you're going to have another symptom pop up, then you would need suppressed. And then you're going to have another symptom pop up and another different body part. So you just really want to address that root cause. And most of the time that'll be lifestyle factors, that'll be diet, nutrition, how much movement you're getting in the day, how stressed you are, how well you're sleeping. So that's determinants of health. And that's a big thing that we look into as naturopathic physicians. And so that's a big part of naturopathic medicine. So we also use, a wide variety of treatment options. So we have, herbs, we have homeopathy, we have diet, like I mentioned, lifestyle counseling, and these all help to just be another option for people in addition to maybe medications, like we can use both natural therapies as well as your more conventional pharmaceuticals or surgeries and other things your regular doctor might recommend. So we just have the best of both worlds. And so that's essentially it. We try to empower our patients while undergoing treatment. We try to empower them before they even get sick. So a lot of emphasis on prevention, which I'll talk about some of the core principles of naturopathic medicine in a little bit. But yeah, that's essentially it as a whole. And I'll talk about our training and what makes us different, yet similar to your regular doctor, other than just our approach to treating, in which I will discuss now. So we'll talk about some training here. So before you get into naturopathic medical school, you do have to obtain a bachelor's degree or higher. And this will just help you get your prerequisites, and then you can apply for naturopathic medical school and then hopefully get in. And there you have a very rigorous 4-year graduate level program, naturopathic medical school. And naturopathic doctors are going to be trained as primary care providers to diagnose, treat, and manage patients with both acute and chronic conditions. So we are primary care providers and seen as that in different states. I'll talk about licensing next in the next slide, but just know that we do have the same training and same background as your regular doctor. The difference is there's a lot of natural therapies that come into our curriculum. So, as you can see in year 1, you're going to have our biomedical sciences. So those are going to be your ologies, anything, pulmonology, gastroenterology, neurology, cardiology. So things like that your regular doctor learns. And then also we're going to do preceptorships. And so that's where you get to learn on the job experiences, where you're shadowing someone in your field, or you can even shadow someone not in the naturopathic medicine world. You can shadow them as conventional doctors. So I've done rotations with oncologists and at urgent cares. So there's a lot of variety in which you can gain experience outside of school as well. And then clinical observation. So during your first and second year, you're actually going to be sitting in on clinic shifts. So you're not going to be in charge because we haven't learned anything yet, really. We're just learning the basics in the 1 to 2 years. But you're going to observe so you can then take in that experience and see what the upper level students are doing, as well as the physicians who are in charge of the shifts and what they're doing. You can just see how the experience works between the doctor-patient relationship and how naturopathic medicine looks. Because most of us before school, we may not have even been to a naturopathic doctor's ourselves because it's not super common. So it just gives you that experience before you're in charge of the shift and start to be more involved in patient care directly. So in addition to the traditional ologies, we do learn a lot of pharmacology. So unlike what most people think of with holistic, they think we're anti-medication use, but that's just not the case. There's time and place for medications, can be life-saving in certain situations. So and that's the beauty of it, because we see maybe that there's some overprescribing going on in the regular conventional setting, but that's like very, because conventional doctors don't have as much wide variety of treatment options, because we use herbs, we use nutrition as some of our therapies. So, only medication use, yeah, that's going to seem like they're just pushing medications and stuff, but medications can be great. So I just want to set that apart, or just point that out, that medications aren't the bad thing. It's just using them maybe too much or too often when other therapies can be used that are just as beneficial and actually addressing the root cause. So we do learn how to prescribe and learn about interactions and what the standard of care is for prescribing medications. Additionally, we also learn diagnostic testing and imaging. So again, I think testing and imaging is great to get done routinely and as needed, depending on what you're coming in for that day. So we do understand how to read and interpret labs that your conventional doctor runs. We also do some functional testing as well that may not be run by your regular doctor. So that's just something interesting we learn. And then we also learn about like functional ranges. So maybe you have, let's say your thyroid's like 0.1 off from being abnormal. We're going to raise that as a red flag. Like maybe you don't have hypothyroidism, but it's getting there. So we need to address it before it becomes an overt disease. So that's something we take in consideration as well. So then physical exam skills. So we learn how to listen to your heart, your lungs, look into your ears, your mouth, all that. And we know how to diagnose based on physical exam findings. So we essentially learn all the standard of care. And we also learn additional things like diet and nutrient therapy. So how to use nutrition and certain supplements in a targeted way to, for certain conditions, and look into the research in that. Botanical medicine formulation. So being able to, use herbs, utilize them in combination with another, and formulate like a tea, tincture, something that's potent and is going to help the body heal itself. Herbs are amazing. I mean, medications come from herbs, and it's just a beautiful thing. I love herbs. Homeopathy, I'm not really going to get into detail on that, but just know we learn a lot about homeopathy. Physical medicine is something we learn. So we do have different physical medicine classes. So I believe there was 7 physical medicine classes that we took, and that was where you're assessing the alignment of the spine. So things that your chiropractor would do. I've done manipulations on clinical shifts where you have a chiropractor supervising you during the process. And so I have been able to do neck adjustments and all that stuff. So that was pretty cool. I don't really utilize physical medicine as much. Obviously, I am telehealth, but it's a great thing we learn. Behavioral medicine, so just how your mind and body play into one another. So that's an amazing thing that a lot of people miss, especially in conventional world. You have therapy, and that's becoming more well accepted, but just seeing that with every person, not just someone who maybe has, depression, anxiety. Like IBS is a lot of stress and how your mind and emotions plays into your digestive system. So we just look at the whole person, like I was mentioning. And then environmental medicine is a big thing that we learn. So how toxins and exposures in the environment contribute to the disease that you're exemplifying, and your overall toxin burden, and how to detox appropriately, and what detox even means, because that's such a loosely used term nowadays. So we're just well trained in it. And yeah, so I went over year 1, 2, 3, 4. Just know that in order to become a licensed naturopathic doctor, you do have to pass all your classes. You have to complete a ton of different like competency exams that involve like real life patients and scenarios. You have to do a bunch of checkoffs while you're on shift and see certain conditions. You have to hit all your graduation requirements, which includes 301.5 credits, which that's going to be nearly triple what you would learn in undergrad. So that just shows you how much we're learning in these 4 years. And then 1,200 plus hours of clinical, which is direct patient care. So it has to be, you are seeing a patient directly, and that's what counts as an hour. Plus you can go above and beyond that. That's just the minimum requirement. And then you have to pass licensing exams. So you have 2 different licensing exams you pass. One's after year 2, so that'll be your first licensing exam, called NPLEX 1. And then NPLEX 2 is the second licensing exams, and that's when you take after you graduate in year 4. And once you pass both of those, you can then apply for a naturopathic medical license. So the first licensing exams I just want to mention is more biomedical science, how to diagnose and different conditions, pathologies, things like that. And then 2 is going to be a lot more diagnoses. We're going to have a lot of naturopathic modalities, how to treat and things like that, as well as use of pharmacology. So how to prescribe medications, and then also minor surgeries on there. So we do learn some minor surgery, which your naturopathic doctor may or may not utilize. It just takes a lot of practice. So that may or may not be a clinical interest of theirs. So you may not see them doing that. But let's see, did I miss anything? I just want to bring up one major difference too is residencies. So residencies for naturopathic medicine is optional. And this comes back to not because we're not because we don't need more training. I think residencies are great and should be in play. It all comes down to licensing, which I'll talk about next, because we're not licensed in every single state. We don't have universal licensure. And since you don't have universal licensure, Medicare, Medicaid, insurance companies don't pay for you. And a lot of the majority of the conventional residencies for medicine are going to be covered by or funded by the US government. So that's why we don't have universal residency options. You don't have to, that's why it's optional, because these residency sites for naturopathic medicine have to pay out of pocket to pay their residents. And it just takes a lot of effort to do that. So we do have residency options, and slowly growing and becoming a lot more accepted for naturopathic doctors to do residencies. I just wanted to point that out because of the lack of licensure. The residencies aren't required because of the funding issue. Let's see. So then naturopathic doctors, let's talk about licensing since we're on it. So we're able to work in either state, whether it's a licensed or an unlicensed state. And I took this picture from the American Naturopathic Doctor Association, so the AANP. And this is going to be a map of which states are licensed. So the dark green ones are going to be your licensed states, as well as the light green. And that means they're either licensed or registered. So like California has licensure, and then it's going to vary on which state has which scope. So scope does vary state to state, meaning you can do certain things in one state that you may not be able to do in another state. So that could include, prescribed medication. So Washington, Oregon, Arizona, those have some of the broadest scope. So you're able to prescribe on your own. You can order labs, imaging, perform minor surgery, whereas states like my home state of PA, they're light green. This is a little tricky because we're not licensed, we're not registered at this point, but there was some licensure passing, and then it kind of got taken back. So then we're still pushing for it. So that one's light green, but it's really unlicensed at this point. So not much you can do in Pennsylvania other than kind of act as a health coach, where you're just providing some, diet, lifestyle, supplement therapies and stuff. So I really encourage you to reach out to your state representatives, local representatives, try to push for naturopathic medicine to be licensed. So that way we can use what we learned in school to help our patients with the best care possible. Because not being able to use what we learned in school is really a disservice to the patients themselves. Because you should be getting the best care possible, and we can provide that. But with licensing, no licensing, that just becomes such a mind game on kind of what you can do for this patient. Because in your head, you're thinking, oh, this patient needs this labs and this medication. But as a naturopathic doctor in an unlicensed state, I can't provide my patient with that. So they have to go through their regular doctor to ask for these labs that they may not even order, or their insurance won't cover, or that they never even heard of. And they might want to put them on a different medication. It just really gets in the way of proper patient care. We have the training to back up what we're doing, what we want to do, to be able to order labs, to be able to prescribe certain medications. So I just feel like this is such a disservice to the patients themselves, and just provides every provider with a headache on what to do with this patient, because they're asking for something. They need something, but they can't get the care they need. So that being said, let's see some other reasons why your naturopathic doctor should be able to work as a PCP, act as a PCP in every single state, because licensure helps protect and guarantee that each provider has met in education standards and continuing education requirements. So making sure that your naturopathic doctors who they say they are, because in these unlicensed states, a naturopath who has no medical training whatsoever can call themselves a naturopathic doctor. Confusing, isn't it? So just making sure that your provider is who they say they are, making sure they have the education to back it up, that they have licensing. And that's why holding a license is great, even if you work in an unlicensed state, just so you can make sure that, hey, I had this education, I have this training, I am who I say I am, and that's why you're coming to see me, and I'm not just deceiving you on who I am by using a different title to confuse everyone. So it also increases access to more affordable and maintainable healthcare. So being able to be licensed throughout the entire country and every single state would allow insurance to cover naturopathic services, naturopathic therapies. So right now, a lot of naturopathic doctors can't or don't accept insurance. Insurance is a headache and it's a pain. For anyone who has insurance, I'm sure knows that. And just because you have insurance doesn't mean they're going to cover what we do. And without proper licensing throughout the country, you can't have Medicare, Medicaid cover these things. So being able to have full scope, full licensing would allow for you to be able to have your visit and therapies potentially covered by insurance. And naturopathic medicine can be expensive for a lot of people. So this is another important reason why licensing, we need the license. So again, you can help by going to the links down below in the comments and trying to get licensing to be passed and push for this in your own state. It's state by state. So if you live in a state that's unlicensed, show your support. And then also naturopathic medicine, can help lower healthcare costs by addressing the root cause of disease, offer less expensive treatments, reduce the need for expensive surgical procedures and prescriptions when appropriate, decrease costs of drug-related side effects. So there, is a lot of side effects that can happen from medication. So being able to use more natural approaches can help reduce those, can help lower malpractice insurance, and offer disease prevention, reduce insurance costs. I mean, all of which are so important, because the US has the worst and most expensive healthcare system, in addition to the highest rates of disease burden. So we're clearly not doing something right, if that's the case. So naturopathic medicine can help shift the healthcare perspective from sickness to wellness. So again, if you're interested in supporting naturopathic medicine, please, please, please take some action. If you have funds, like money on hand that you can donate, that can go a long way, because we have to pay for lobbyists and for certain legislative things. So donations are always appreciated. And especially for unlicensed states like Pennsylvania, I really, really want Pennsylvania to become licensed, because my family lives there. And it would be just so important for everyone to be able to access naturopathic medicine and be able to afford it. So yeah, we'll get off that tangent and move to the next thing. So each naturopathic doctor practice is different, but we all have similar core beliefs. So one being do no harm. So this is a core belief to all medical practices, not just naturopathic doctors. The way naturopathic medicine places an emphasis on doing no harm is by using the most natural and least invasive therapies to prevent and treat disease. So, and then we also know when to provide or when to refer to other providers. So if you present in a way that's outside of our scope of practice, like let's say you need a cardiac cath, you're having a heart attack, I'm not going to take that on. I'm going to refer you to the emergency room so you can get directly to a cardiologist for that. Then let's see, healing power of nature. So I talked a lot about how we use natural therapies, but we also use natural evidence-based therapies. So whether it's a standalone or an adjunctive therapy, we can use that safe and effectively. And then identifying and treating root causes. Symptomatic relief may be needed in some situations, but we're really just trying to understand your body as a whole and why illness is happening. So we also try to remove the root cause and any obstacles to cure. And naturopathic doctors, we are always educating our patients. We spend 60 minutes during the initial intake with them, trying to educate them on why maybe disease is happening and just build a better relationship with our patients so that there's more compliance between what we're suggesting, which is important because a lot of our suggestions aren't just here, take a magic pill. There are a lot of hard work. So just education is super important for that. And then treating the whole person. So we understand your body doesn't work as separate units. It works together. So each system works as one. For example, your gut, your brain, your skin, all of that works together. So we evaluate you as a whole rather than just treating one specific system. And then prevention. Prevention is super important. We emphasize prevention so much. We specialize in that. That is because we know that prevention is what keeps people healthy for long term, and knowing to step in before a disease even happens, because once it happens, it's so much harder to treat, and it's better to not have to suffer at all. So then lastly, here are some things you might expect. So I talked about herbal medicine, supplements, lifestyle nutrition. We also do some IV nutrients, injection therapies, things like that. And then hydrotherapies and really cool other option. Just really depends on who you're seeing and what they prefer to use. So that was a lot about naturopathic medicine. I hope you really found it useful on what I was telling you about. If you do have questions, put them in the comments below. Up next, because this is one of my first videos, so I am going to be talking about myths versus facts about naturopathic medicine. I covered maybe a few of those, but I'm going to go into more detail about them in the next video, so stay tuned for that. And I just want to say thank you for watching, and make sure to like, comment, share, and subscribe to my page. Show some support for me and naturopathic medicine. And I just hope you have a great rest of your day, and just keep an eye out for other videos I make.